My name is Jeffrey Fong. I'm a professor of psychology and also in the School of Public Health and Health Systems at the University of Waterloo. The research project that I head is the International Tobacco Control Policy Evaluation Project, also known as the ITC project. It's a consortium of over 100 researchers across 23 countries throughout the world. And these countries where we're doing our work are inhabited by over 50% of the population of the world and over 70% of the world's tobacco users. By training, I'm a social psychologist, so I did work in experimental social psychology, but really my research field is in global public health. Our research is focusing on whether or not we can reduce tobacco use throughout the world. Tobacco use is, surprisingly for some, the #1 preventable cause of death and disease in the world, and threatens to kill up to 1 billion people in the 21st century. So we're doing research on whether or not policies designed to reduce tobacco use, like smoke-free laws and graphic warning labels and higher taxes on tobacco products, will have the effect of reducing tobacco use and therefore reducing the deaths and disease due to tobacco use. Our findings are of great interest and value to governments who are trying to assess their current tobacco problem, as well as for figuring out, for giving them research evidence whether or not their policies are actually working or whether they need improvement. And so whenever I and our team travel to various countries to present our national reports, there is a considerable linkage with governments, health ministers, other researchers, and so on, and also, of course, the media. At any given time, about 70% of smokers themselves are wanting to quit. And about 20 to 40%, depending on the study that you look at, are actively engaged in trying to figure out how to quit right now. And so, sure, you're always going to have people who are never going to quit. You're always going to have people who are never going to start. But that's not really the audience for behavior change for that policy. It's really the fuzzy middle, of which there are 20 to 40% of people considering quitting, where information campaigns, being reminded of the harms of continued smoking can really make a difference. And so what we found in our research on the ITC project is that graphic warning labels do indeed have a strong impact on getting people to think about quitting, all the way up to intentions to quit. And we have linked across different countries the effects of the graphic warning labels on intentions to quit. So if governments make the commitment, these laws are going to drive down smoking rates. They're going to reduce the exposure of the public to secondhand smoke, which is highly carcinogenic and dangerous. And in general, when governments support strong tobacco control policies, those policies work. And that has been the general message of our findings on the ITC project across our 20+ countries.